views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Good evening. I am Errol Schneer, Bronx Lebanon Hospital Center's Vice President of Planning, Marketing, and Public Relations, your co-host for tonight's HealthBeat television program. We welcome you, our many viewers, and as always, encourage you to continue participating in this program. And we promise to do our very best to keep you medically informed and healthy by discussing the topics that are of interest to you. You can also find out more information about Bronx Lebanon and its many community services online at our website, bronxcare.org. Tonight, my co-host, Dr. Milton Gums, Bronx Lebanon's Vice President and Medical Director, and I will begin a two-part series on a new, innovative, and model career-building program that is also reaching out to improve the health in the community.
Yes, the Community Health Workers Apprenticeship Program is really making a difference in the Bronx.
And it's helping individuals to truly understand their healthcare needs.
Addressing the healthcare needs of the Bronx community by helping individuals understand health problems at an early and more preventable treated area staging, potentially reducing hospitalization and repeated admissions. Joining us this evening to talk about this program is Dr. Doug Reach, Chairman of Family Medicine, and the individual leading this most important program. Dr. Reach, welcome.
Thank you.
Now, Dr. Reach, before we hear from you, let me once again encourage you, our viewers, to tune in this evening as you always do. And this week we will be departing from our normal format by not having an actual call-in number, but this time you can certainly get the information you need about this important program, as well as the community services that Bronx Lebanon offers at our website, bronxcare.org. Now, Dr. Reach, let me start the program by asking you to provide our viewers with an overview of this program, how it started and why it's so important.
Absolutely, Mr. Schneer, and I want to thank you as well as Dr. Gums for having me and a couple of the community health workers who we're going to meet in a few minutes to share with you what a community health worker is and what the community health worker apprenticeship program is and the opportunity it affords for people that live in the Bronx and are therefore and also employed in the Bronx. So first of all, let me talk for a moment or two about the Community Health Worker Initiative or program. This is not just, a Bronx program or a New York City or New York State, but it's a national movement to develop community health workers. And this is part of the way that we're actually creating healthcare reform in the United States, New York State, and in New York City in particular. Community health workers are actually folks that live in and come from the community in which we serve. So they're from the Bronx. They represent neighborhoods and communities, and they then are employed in the institution, in our hospital, and they are the extension of our practice into the community and the community back into the practice. You can imagine how critically important this is so that we as providers, as physicians, nurses, can understand the problems, the issues, and the concerns that people have from the wide variety of cultures, religions, ethnicities that we provide services for in the Bronx and in the South Bronx, again, in particular. So we're really proud of what community health workers do. They educate patients, they do home visits, they ensure that patients keep their appointments in the event that they arrive in the emergency room or admitted to a hospital. The community health workers leave the practice, go and meet the patients where they are and where they're at. We've seen incredible results that we're going to talk about later on in the program from this phenomenal initiative that we've had actually in existence for quite some time at Bronx Lebanon, and we truly are leaders in this area.
Okay. Let me ask you, what are some of the outcomes that you have seen up to now?
Well, and let me address that, and I also want to talk about the apprenticeship program, which is sort of a special and interesting twist. The outcomes actually are such that when we've addressed problems such as diabetes, HIV/AIDS, hepatitis C, congestive heart failure, or problems in general such as food access, education, training, housing, are problems that people have that are in our community. The community health workers, excuse the expression, but they tackle these problems for each and every patient that they care for and help address. So you noticed I didn't talk about, treating the medical problem, but rather treating the whole the psychological and social and medical problems at once in the community where the patient is at. So in fact, and we've seen phenomenal outcomes, hemoglobin A1Cs coming down, congestive heart failure improving in large cohorts of patients. Those are a few examples.
Okay. Well, at this point, let's pause for a short break, because during the next part of HealthBeat, we will actually be hearing from the apprentices involved in this, I would say, groundbreaking program. Would you say that, Dr. East?
Totally agree, absolutely.
Hospital Center is advancing computer systems to benefit its patients and the community.
What is really important is that the technology we provide is truly helping the community. And as a result, our physicians, nurses, and staff are really succeeding in optimizing patients' care and access, as well as patient safety and satisfaction.
Our staff relies on the comprehensive health information systems we have in place to expedite the registration process and make the appropriate medical decisions regarding treatment and follow-up care.
At Bronx Lebanon, highly specialized care is being provided by an expert staff using state-of-the-art technology. Bronx Lebanon surgeons are also at the forefront of advancing technology.
We certainly have cutting-edge technologies in place, but what is especially important here is that we have surgeons, nurses, and technicians who deeply care about our patients.
Bronx Lebanon's ear, nose, and throat department is also performing highly complex surgical procedures.
We are bringing all types of technological advances to our ENT patients, including the latest in facial plastic and reconstructive surgery, designed to achieve successful outcomes.
And Bronx Lebanon's orthopedic team is keeping patients moving in the right direction.
We have leveraged our own patient outcomes data as well as national studies to achieve the highest level of care in hip and knee replacements. Our spine, hand, and foot surgery, as well as sports medicine programs, continue to be of the highest caliber.
Extraordinary is the best way to describe the sight-saving surgeries performed by Bronx Lebanon's ophthalmologists.
We are using sophisticated laser and complex surgical procedures, as well as microscopic technologies to protect and restore vision.
Bronx Lebanon is also delivering exceptional services for women. Its one-stop shopping approach means easy access to a wide range of general and specialized inpatient and outpatient OB/GYN services.
We provide women in the community with a luxurious birthing spa in a state-of-the-art labor and delivery unit and comprehensive outpatient GYN services at the hospital's new Health and Wellness Center. When necessary, advanced robotic surgery and other related procedures are available.
In the ER, we see some of the most dramatic examples of Bronx Lebanon staff and technology in action.
Our expert and experienced ER team is helping patients overcome all types of emergencies. We are effectively using high-tech equipment to monitor, track, and evaluate a patient's condition prior to making the decision to admit, discharge, or extend their observation in our recently completed 11-bay unit.
And technological advances are changing the practice of nursing.
Our nurses are fully prepared and eager to meet the challenges and benefits that technology has to offer. We are now using an electronic medical record, which is providing nurses with the time to do what they do best, provide excellent care for our patients.
Bronx Lebanon is also leading the way in anesthesiology, dentistry, family medicine, neonatology, neurosurgery, pediatrics, psychiatry, and long-term care.
Welcome back to HealthBeat. We come to you live on BronxNet every Monday evening from 6:30 to 7 p.m. Please visit our website at bronxcare.org with any questions you may have or any comments you may have, and we will certainly do our best to answer your questions. Now let me introduce our actual apprentices for this evening. First, let me start with Roberto Claudio from Family Medicine. Roberto, welcome. And then let me go to Daryl Thomas, who's from Pediatrics. Welcome, Daryl. And lastly, Cheryl Garvin, who's from OBGYN. And before we ask each of you some questions, I wanted to turn it back to Dr. Reach because I believe we cut him short, and he was actually talking about each of you in a general way, what apprentices do and how they function.
Right, so just briefly I wanted to mention, and I'm glad that we have a two-part series and we can talk more about this next week because it's such a phenomenal program, but the Community Health Worker Apprenticeship is truly a unique collaboration between a variety of organizations. I already mentioned that it's a federally recognized apprenticeship, and the apprentices upon graduation actually receive certificates, which is transferable to other institutions if they were looking for career advancement or movement. Yeah. But the collaboration is between, and I mentioned this already, between the Bronx Lebanon Hospital Center, the departments, the human resources, the administration, family medicine, obstetrics, gynecology, pediatrics, also the City University of New York, LaGuardia Community College, 1199 Union, 1199 Training and Education Fund, and funding from New York City. It required all of these organizations to come together, do a lot of planning in order to set up this phenomenal apprenticeship. We have completed our first apprenticeship cohort, and they are now actually graduates, and we're soon to begin our second cohort and planning with a third cohort. Wow. So we're not sitting still, we're moving forward in a very dramatic fashion.
And now let's hear it directly from Roberto, from your experiences at this apprenticeship program.
Well, thank you, Mr. Schneer and Dr. Gum. The experience has been, for me, amazing. I mean, to see the administrator, Dr. Reach, his all hands, the clinical staff, and the other workers, everyone is all hands to support all of us. We've been at it now for a little over 6 months, and it involved classroom training. It involved at least 3 huge textbooks that deal with, community health. But basically, we had some wonderful LaGuardia College facilitators, and also the union supplied us with staffing that were there in the classroom with us to provide us with that extra support. So it's been an amazing experience. And just before you guys cut me off, we were actually we were actually working as we were learning.
Okay, Daryl, let's hear about your experience.
We'll definitely feed off of that. The working while actually in the room, and it was just really insightful. And then to be able to use what I learned immediately in the field, I think was the biggest opportunity for us, because it touched right with what we're doing. Then, as I was given certain caseloads, and then the work that what I learned in the classroom, the impact was just greatly great. So,
that's good.
Yes.
And Cheryl, let's hear from you.
I can also relate to the same thing as the experience gave us. The experience that we learned in the classroom, it gave us the experience in the field that I took with me, that I'm still teaching my clients every day how to gain the experience that I learned. I helped them to outreach. Yes.
Okay. All right, Dr. Reach, comes to you again. Now that I've heard from all of these apprentices, the logical question is how individuals can become involved in the program, other individuals. How many can you have?
Phenomenal question. Actually, and as I mentioned, the community health work movement nationally is moving forward in leaps and bounds, and it truly is. So we're rolling out our second cohort, our third cohort of 15 to 20 people to be educated. And the great news is that Bronx Lebanon is committed to hiring these folks. And these folks are from the community. What's also really neat is many people come in with, this is their first job, or they move into an entry-level job, and many of the apprentices were working in transportation or housekeeping or dietary services, and that was their first professional experience in healthcare, but they realized they wanted to do more. So as a result, they stepped up, they connected with human resources, spoke with their union, and here they are completing their apprenticeship. So in order to learn more, reach out, as Mr. Schnur said, through our website and express your interest. Also contact our human resources. There's also a large network in New York City for community health workers.
Now, I'm going to give Darryl some equal time. I was going
There
to
you
turn
go.
this question over to Dr. Reach, but share with us some of the outcomes, the health outcomes that you've been able to influence the community to practice good health care, those type of things.
Okay, so I deal with asthma, and dealing with asthma is, sometimes you don't see it as soon as you would like. So what we would do is we would base it on the amount of times that we don't see them in the emergency room or the inpatient. So the education and some of the things we're doing now with getting IPMs. It's a big.
What's an IPM?
IPM is integrated pest management. So in the Bronx, we have a big problem with pests, and those are big triggers for asthma. So just those things that we're doing right now. We also give away HEPA vacuum cleaners, air purifiers.
It's a full-scale holistic approach.
Yes. So that's what we're gaining from right now. What we're seeing.
And what about you, Roberta? What do you have to add to what he said in terms of health outcomes
Well,
in the family medicine area, particularly because that's your specialty?
Well, my thing is asthma prevention and also diabetes, in particular diabetes. Diabetes is a huge problem with our population and personally affects me at home as well. So we go out there, we do the door knocking, we visit people's homes, we do the education in the senior centers, we go to the community centers, we also do a lot of outreach to find resources for the people in the community, a holistic approach.
I'm going to ask you a bad question. What makes you think you are making an impact? All three of you. Yeah.
What makes me think I'm doing an impact?
Yeah, what makes you think you're doing something
With
for
the
the patient?
experience I learned in the classroom, I can take it to the clients that I have. I'm in OBGYN, so I deal with the pregnancy and the birth up until 2 years old.
But are they listening to you, what I mean?
They are, the education that we give them and the home, by going to their homes and sitting down with them and talking to them, yes.
Now, what happens when you knock on the door? Are these people, the residents of our community, surprised to see someone like you intervening in their health care? It must be an amazing experience for them.
They see us. They see us in the community. We go to the community centers. We go to their local meetings. They've already seen our faces. And the main thing is that we're from the neighborhood. I worked in that neighborhood for over 10 years. I lived in the neighborhood for over 10 years. And so I have an advantage because they trust us. And so it's a huge problem that they don't trust large institutions. But we provide the actual face. We represent the hospital, and they feel comfortable with us.
Right. Okay.
I would add there, and I bet each one of you has a story that, and you might not have time to share, but a story about a patient who you've really made a significant difference with, and I wouldn't doubt that whatsoever. I mean, the other piece that I would say is, what these three folks are able to do is bring what they learn in the community back to our practice. Right. So it changes and influences what we're doing. Right. If Darryl sees a patient in the community where there's pests are the problem, we may not know it as sitting in our offices and continuing to prescribe medication. So he says, hey, wait a minute, we got to take care of that before we worry about the medications. So it's really a powerful tool that they have by bringing back and sharing with us what they learn.
Right. Okay. Does each of you have a specific success story that you can share with our viewers?
Yeah, I would start. I definitely do. Without naming anyone, we have a situation where, like I said, the pest situation was, egregious, and they had other things as well. So we are also partners with BronxWorks, and so they were having a rental issue as well. So they were able to help them pay their back rent. And as well as paying the back rent, they were also able to do the IPM and get that stuff straightened out. And, 3 months later, the patient calls and she just lets me know, she thanks me and tells me everything is going great now and blah, blah, blah. So that would be a success for me.
Okay, and Cheryl, do you have a success story in the women's health area?
Yeah, I do. Well, since I'm in OBGYN, I help patients with resources from outside of like clothes and things that they need for the baby. And I helped this one particular mother that she didn't have anything. And I came to the hospital at the right time because we do rounds in the hospital. Our 5th floors are rounds that we do. And I came at the right time. And she said, oh, wow, thank you for the help you've given me. I really appreciate, things I could use for my baby.
Okay. You have a question for Dr. Reach.
What does the future hold for this program? And can it be replicated in other communities, you think?
Well, absolutely, it could be replicated. It's
a need.
Yeah, and the need is huge. It's an old model, actually. It dates back over 60 years. And so, in fact, not only in the United States, but internationally, and it's proven to work in a wide variety of ways. So, in fact, and can it be replicated? Other hospitals are talking to us about this, other institutions, federally qualified health centers. We've even had private doctors' offices coming in and saying, tell us about community health workers, tell us how this apprenticeship works. So we really had a lot of interest from a wide variety of organizations and entities, yes.
Now, Roberta, I'm going to turn it back to you. What's the next step for you? I mean, perhaps you can also trace where you are before you started in the program.
Well, I've always done community work for the last 25 years. My background involves workforce development, after-school programming, and leadership development of youth and adults. So when I came on board, it seemed like a perfect fit. I wanted to do something that would be more direct and touch the people in the community more directly. And interestingly enough, Dr. Reach kept telling me, there's something coming up, there's something coming up, there's something coming up. And bam, all of a sudden I'm in this training. And we have a saying in the Department of Medicine, family medicine, and that is reaching one person at a time. And that's what community health workers do. We reach people one person at a time, families at a time. When we go into somebody's home, we're looking at the whole, how they're living and how best to guide them, families, individuals. It's a wonderful experience.
But you also said that the discipline in terms of studying is quite extensive.
You have to put the time in. I mean, you have to put the time in. You have to understand what it is you're doing and understand how these diseases are impacting our community. And more importantly, how is it that we as an institution and we as CHWs can actually go out there and do the preventive work.
When you go to a house, there's always someone who doesn't believe in you, isn't there?
Yes.
How do you win that person over?
By being consistent, by being true, by being transparent. Transparency and consistency and honesty, that's what we do best. I mean, to show them that we're here for the long haul. Consistency.
Yeah. You want to?
Do you want to add to that? Sure.
I agree with him. We keep calling and going to their house and popping up, making sure they're making their appointments, making sure they're being consistent with them all the time. It helps us to get them to trust us with the relationship. Yes.
Now, how does the faculty get involved, Dr. Reach, at Bronx Lebanon in terms of teaching each of the apprentices?
Yeah.
Perhaps you can expand on that.
Oh, absolutely. I mean, and in fact, in every discipline, we're totally integrated. I would actually say we have resident physicians involved, attending physicians involved in the community health worker apprenticeship. Nursing also is involved in interacting. So not only in the teaching and the education of their apprentices, but also in the care. All of our departments have what we call case management rounds. They go by different names, care coordination rounds. Right. And we actually sit down and with the community health workers who lead the discussion, talking about what are the issues and problems of individual patients and how we can best help them. Answers come from them, less often from us.
Now, the other thing I wanted to re-explore, career advancement. This is not the last step for them, obviously. They can go pretty much as high as they want.
Oh, you hit the nail on the head. And in fact, there's opportunity and career opportunities in nursing and or in social work. And social work is really an area we've had several people who have gone on to get their bachelor's and master's degree in social work and now are employed in our system.
Right. Now tell us, Dr. Gumbs was asking you about how to enroll in the program. How many students do you take?
So we take 15 to 20 per cohort, and that's what we had this past time. Usually we are taking from internally because folks are looking for career opportunities, but if someone has a significant interest, there's also opportunity for folks to come from the outside and apply.
Tell us about the graduation, Darryl. I understand that you had a special ceremony. It must have been very important to you and your family.
Yeah, we had two. The first one I was able to bring my daughter, and so that was good for her to see. She didn't get to see when I graduated college, so this was cool for her. And like I said, so it was just a great opportunity.
And how about you, Cheryl?
The same thing. It was a nice ceremony. They really appreciate it very well.
And lastly, save the best for last, right?
Well, what I enjoyed most is having everybody there, everybody that's been affiliated with this.
But you have been at a hospital before this program. You want to tell us?
Well, I was employed as a I forgot the name of the title.
Well, it was sort of a community liaison.
Right.
But you hadn't had any formal training as a community health worker.
And so they were bringing me along, and so I was a community liaison and meeting with the people.
That's
the
half the way already.
Yes.
Yeah.
And it's just and then I landed in this program. It just brought everything.
Well, I'm going to have to interrupt you at this point, but we'll have more of an opportunity next week to hear from some of the other apprentices. And Dr. Reach, let me thank you for joining with Dr. Gumbs and myself on tonight's HealthBeat television program, as well as you, Roberto Claudio, you, Darrow Lemon, and you, Cheryl. And sorry, Cheryl, I forgot your last name. But most importantly, let me thank you, our viewers, for tuning in this evening. And Dr. Gumbs, I think you want to say something?
If any of our viewers have questions or need assistance, I encourage you to call our physician referral service by dialing 718-99-BRONX. That is 718-992-7669. Or you can refer to our website at bronxcare.org. Good night, and see you next week, when we will be
continuing our discussion of this apprenticeship program.
This problem. Yes.
So thank you.
We cannot be bystanders.
We can stop to make sure someone is okay.
We can warn someone when their drink isn't safe.
And disrupt the situation.
We can
get someone a cab.
Or walk them home safely.
We can make campuses safer for our friends.
Our roommates.
Our classmates. Our fellow human beings.
We cannot be bystanders.
We can intervene.